Welcome to the Medical Sales Podcast. I'm your host, Samuel, founder of a revolutionary medical sales training and mentorship program called the Medical Sales Career Builder, and I'm also host of the Medical Sales Podcast. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire world. It doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing and diagnostic lab, you name it, you will learn how to either break into the industry, be a top 10% performer within your role, or climb the corporate ladder. Welcome to the Medical Sales Podcast. And remember, I am a medical sales expert sharing my own opinion about this amazing industry and how it can change your life. Hello and welcome to another episode of the Medical Sales Podcast. And I'm your host, Samuel. And today we have our very own April Hoffman. She is an enrollment director for Evolve Success. This is why this is an episode you got to listen to, though. April was a physical therapist for over 10 years, who then the hard way got into medical sales with a journey that took almost 2 years. Then through life, she became an employee here at Evolve Success. She's running things. It's amazing. She's an enrollment director, and her journey from physical therapist to a leader at Evolve Success is something you absolutely have to hear. If you're a physical therapist, this is a no-brainer. You better listen to this episode. If you're a healthcare worker, I'll go ahead and say that. Again, another no-brainer episode that you got to listen to. But if you're anyone else, the value here is you're going to understand what really goes into who gets these kinds of positions, why they get them, and why it makes sense for some of these connections between being a healthcare worker outside of medical sales and being a medical sales professional, and the fact that it really doesn't matter whether you're a healthcare worker or a sales rep or a business admin or a dog walker or a bartender or whatever it is that your story belongs to. There's an opportunity for you if you're with the right people, going through the right thing, and you're connected to the right opportunity. So this is one of those episodes that you just got to listen to. It's one of our very own, April Hoffman. She's fantastic, and I really do hope you enjoy this interview. April, let's take it to the beginning. Why don't you tell the audience exactly who you are?
So yes, I'm April. I am a physical therapist by trade. I actually graduated with my doctorate in 2011. To be very honest, I knew I wanted to be a physical therapist since I was 14 years old, which isn't really common for most people. I tore my ACL at 14, common story. I was an athlete my whole life, and literally spending so much time and somebody being able to help me regain function and get back to the soccer field. I went on to play in college. So I was very passionate about I want to do the same thing for other people. But yeah, so I knew at a very young age, I worked really hard to get into PT school, and it was a long, very expensive process. I worked as a PT for about a decade, and in every setting you can imagine. I mean, I moved around so much, and in that world, it's really not shunned upon to do that, because it's almost looked at okay, the more experience, the more exposure you have. I was really sold the impression that the beauty of that industry is that there are so many options.
So let me jump in, because I want to understand why a PT becomes a PT, why someone with your calling becomes a PT.
I was 14 when it first happened, 14 years old. I was a competitive soccer player. I played very competitive soccer my whole life. Tore my ACL at 14. So blew out my knee. I was a young patient that at that point that they had done this reconstruction on, had full reconstruction, went on to play soccer. So I spent 9 months in intense rehab.
Oh, wow. So, okay. So that's where this. That's
where it started. Yeah. I was at that point, I knew in high school when we would do the career days, I was I want to be a physical therapist. So I was very passionate about that. Then yes, went on to play college soccer. I actually blew out my other knee.
Oh my gosh.
Again, playing semi-pro co-ed soccer here in San Diego locally. And was back in physical therapy. And at that point, I was applying to grad school. So imagine my story, my interviewing process, I was why do you want to be a PT? I'm
well, look at me. Right.
Literally the epitome of being a physical therapy patient.
So when I think PT, I just think, okay, a PT is someone that when you get hurt, you go to them, you see them, they give you all these cool exercises, they move your muscles for you, they get it going. This can take a couple of days, a couple of weeks, a couple of years, whatever your situation is. But it sounds like it's a little bit more levels to it and different things. Can you just kind of give us a rough picture? What does it mean to be a PT? What do you think you're getting into before you actually become one?
I think with our industry, to be very, very honest, is that there hasn't been a true, hitting the ground and exposing what we do and how much we impact people's lives, because really physical therapists do so much in every setting that you can imagine, whether it be pediatrics, neuro, to, home health, school district, home assessments. There are so many levels. Every person, every single person listening to this that's out there, every family member at some point either has been in physical therapy or will be in physical therapy. There's so many clinicians that are in that rehab world that will impact us at some point in our lives or our loved ones. So it's really crazy to me that people don't know enough about what we do. But yeah, so really it's functional, right? It's about function and occupation. If you're talking about occupational therapists,
Okay.
it's helping people literally at their core get their function back and regain strength, whether it be mobility, whether it be brushing their teeth, whether it be after a stroke, feeding themselves, whether it be after a sports injury, regaining the strength to go on to be a professional athlete, or a kid that had broken their arm and needs to regain function. So there's a lot that goes into it. It's not just, the exercises, of course, that's important part of it, but it's really also assessing and understanding the individual person and what their needs are, and how to give that approach very individualized, because every person's different, right? Every anatomy is different,
Right.
every human
Right.
is different, every approach is different, which, not to give it away now, is why therapists are amazing salespeople. They have been bred to be that way.
No, that makes a lot of sense. So, back in the day, right, when I was just coaching, and I was working with all kinds of professionals to get into medical sales, like I'm talking 6 years ago, 7 years ago, I would talk to some PTs and they would complain about the finances.
Mm.
So I'm assuming though, if you're going to be a PT, there must be a dream there that like, okay, as a PT, I'm going to change people's lives. I'm going to make great money doing it because the dream is this. What is that dream? Because
Yeah.
everybody I talked to, they would have almost like the same gripe, which is a lot of school, a lot of work, a lot of value I've provided for changing people's lives, but the compensation is not matching. What is the dream that you heard before you became one, or that people hear when they want to become a physical therapist?
How much time do you have? No, I'm just kidding. Yeah, I'll be careful here. I will say, the profession's consistently changing. A
Sure.
lot of the foundation of what we do stems from reimbursements, right? In the healthcare system. And everybody can probably agree that's just always up and down and all over the place.
Gonna be
So
what's going to be. Yeah.
it's very difficult to really know at any given time, like what the future projection of that is going to be. For me, going into school, the vision, and everybody that's a therapist will know this, was Vision 2021, I think it was at that time, Vision 2020. And the point of that vision, and mind you, I started grad school in 2008. So that was a long way off from me, I was like, oh, Vision 2020, like that's seemed like infinity. But that was to have direct access to, if you have an issue, you can go right to your PT office and they can assess you, they can diagnose you, they can refer you out. Like there was a lot of autonomy that was being sold to us. Like you're going to have so much autonomy.
Sure.
You're basically going to be a primary care provider. That was the vision. That never came to fruition. There's little bits and pieces of that might have trickled, and there's aspects that are better, but it never came to fruition. And we're in what, 2025 now?
Sure.
So, we all were really sold, and they were hopeful. Like, I don't want to say that this isn't because the professors and things like that in the schools, like I do think they advocated and they tried, and that has to go through.
So is that because you're going to have your own practice as a physical therapist, and because you're going to be that point person, you're going to have a lot of business. So as long as you're doing your job and helping people, the money's going to be there. Is that what?
And more autonomy, more freedom. You're a primary provider. It's like saying that instead of calling your PCP, you're calling your PT. Like, hey, I'm Dr. Jones. I busted my knee. What do I do? Come in. We'll assess you. We'll be able to go for that. Diagnose you
where you need to go. Yeah.
Imaging. I can refer you out. Like there should have been. That was the goal. So for us going in, we're like, cool. We're going to be doctors. Not to mention they changed our entire education system.
Oh wow. Okay.
Over very quick. Like when I was applying, it was a master's. And then it was like, oh, now it's a doctorate. There was we didn't have a choice at that point. That was the direction of the profession. Of course, they grandfathered people in, but you had to become a doctor. And the reason for that was them to pitch, like, these are doctors of physical therapy. They added, more pharmacology, more like radiology and, imaging courses so that you could, and differential diagnosing, to basically push this idea that you were going to be an autonomous practitioner. With that came what? a raise in tuition. So the education immediately went from this, affordable healthcare, I'm going to have a stable job as a rehab person and help people, to now I'm supposed to be a primary care provider essentially and a doctor.
Yeah.
And now the schooling had to match that. And so the tuition you just saw, I mean, if we looked at data, I would be probably blown away at the difference in the tuition.
And while this is happening, what about the other side, the people that are actually doing it, the physical therapists? Is their pay starting to creep up, or were they being told that it's coming, don't you worry, it's coming? Or like what was going on?
Oh yeah. And a lot of them hated it. I mean, the OGs were like, this is ridiculous. Like, you're not going to tell me some new grad because their name is doctor is going to know more than me with a bachelor's who has 25 years of experience, so there was a lot of that was a big issue coming in with like trying to compete with those personalities. And then also, we did think we were cool and tough and doctors, right away, right? Like we earned it. We earned it.
Yeah.
But,
Yeah.
you're kind of naive to that sense. And also, you're hopeful still, right? Because really, like you said, the core foundation, why, if you asked therapists why they became a therapist, it was never for the money.
Right.
And back then it was honestly a little bit more affordable to breathe air at that point than it is now.
Fair. Fair.
But so we were like, cool, like we have autonomy, we're providing really great care, like we're very passionate. Most of us didn't want to go, because people would always say, like, why are you getting your doctorate when you could go to med school? And most of us were like, well, we don't want to go to med school. Why would I want to do that? Because I don't want to be forced to a certain specialty. That's why a lot of people go into physical therapy. There's a lot of that freedom to be like, I want to go be neuro this week, and then actually.
So is it even accurate to say that like every physical therapist's dream is to own their own physical therapy practice?
That's the worst statement I've ever heard.
She's like, that could not be more wrong.
From the crew. Oh my God, no, that's like
the for us. Like what's the reality, and who really wants that? Who does versus who doesn't want that? And the one that doesn't want that, what do they want to do? So go ahead.
And again, I think that's going to go back to what decade of life we're in, right? Because probably when I was starting PT school, that probably was a little bit more of a realistic goal for people.
I see.
For sports teams was like really appealing, being in orthopedics, unless you were super into neuro, right? Like I was kind of a nerd. So I was like vestibular was like my jam. And so I thought it was really cool to work in like the neuro units and stuff. But yeah, owning a practice, like I can only really speak to myself and the population of people that I talk to now, especially too. So, it's a good basis for what I'm going to say. Most people don't want to have a brick and mortar. That's not a big goal. It's very expensive and it is incredibly hard to be profitable. You cannot be a brick and mortar standalone physical therapy clinic and be profitable.
Gotcha.
Especially with the current rates and reimbursements, it's nearly impossible to do that. And I know when I was, like I said, when I was 14, I was spending 9 months in rehab 3 times a week, extensive 60 minutes with the therapist, manual therapy. Now, you're looking at a few weeks, maybe, half the time you're spent with an assistant, and they have to do that because they can't make money.
It's not feasible. Yeah.
Yeah. So no, it is not a goal of most people. I think if anything, in an integrated space is now the new way of doing that, having some sort of
to be part of a real powerful team and be the physical therapist representative on that powerful team. So those guys in physical therapy school, those girls and guys in physical therapy school right now, they're dreaming of being on that multi-specialty team and being the physical therapist representative.
Yeah. Or working for just like a really good clinic that takes good care of them and gives you flexibility and freedom. There are a lot of options. I will say that, but
So is the cat out of the bag? Because right now there are physical therapists that are not physical therapists yet, but they're being trained like right now.
Yeah.
And do they now expect that, the money might not going to be there, but gosh, I love what I'm doing. I'm doing this anyway. Or is it still like this undisclosed secret?
No, I think it's okay. So now we have all these groups, right? We have all these Facebook groups. Not to age myself, but like honestly, when I was in school, it's like you had to pull your laptop out to get to Facebook, like there weren't all these social media platforms. Like you weren't reading this blog post on your way to class. Now it's a lot more accessible to understand these things, right? Like I'm in a lot of those groups and they're brutal. Some of them are very honest, like run.
Wow.
It's the worst group on your investment ever. Like run. So, I'll be honest, what I tell people, if you are truly passionate about it and you have the means, do not bankrupt yourself becoming a therapist. I'm sorry. I do not care how passionate you are. There are other things that you can do to impact patient lives without bankrupting yourself.
Yeah, it is what it is.
Don't do what I did.
Yeah.
But, like my mom always used to say, do as I say, not as I did. So, I would say like it's pretty clear now that it's going to cost what it's going to cost. And there are options, as far as if you can get a scholarship, if you can do like a prolonged course. I literally had this conversation with my husband the other day, and I was like, looking back, right? 2020 vision, always in retrospect. I was like, I was so stubborn. Like, why didn't I go to school in like Minnesota for 2 years? Like, who cares, right? I was just like, no, I'm staying in San Diego. Like, why, like you don't think about the future too much when you're in it, because you're just so like passionate about like, I need to get through this. I'm excited. You're not really thinking about the long-term, outcomes from that. I didn't think about the debt that much because I was sold the dream that this was going to make me profitable.
Yeah, it'll take care of itself.
So now I always say there are options, like if you really are passionate about it. But I will tell you this, if you're going to get your PT degree or OT degree or SLP degree, I at least like one of the things I'm very passionate about, and we talk about this often, is like just letting them know that there's alternative options out there.
If you don't like it, or if it doesn't work for you for whatever reason, there's something else you can do with all that education and that know-how that you have. I like that. Hope you're enjoying today's episode. And I want to let you know our programs cover the entire career of a medical sales professional. From getting into the medical sales industry, to training on how to be a top performer in the medical sales industry, to masterfully navigating your career to executive level leadership. These programs are personalized and customized for your specific career and background, and trained by over 50 experts, including surgeons. Our results speak for ourselves, and we're landing positions for our candidates in less than 120 days in top medical technology companies like Stryker, Medtronic, Merck, Abbott, you name it. Would you run an Ironman race without training and a strategy? You wouldn't. So why are you trying to do the same with a medical sales position? You need training, you need a strategy, and you need to visit evolveyoursuccess.com, fill out the application, schedule some time with one of our account executives, and let's get you into the position that you've always dreamed of. How do you land on medical sales? What happened?
Yeah, so funny. I did not even know medical sales was a thing.
Okay.
Funny enough, because I had worked in all these settings and had all these devices, but never, and even had presentations and things like that given to me and people coming in. And, for us as therapists, it was always like, oh, you're bringing us pizza, like, and donuts, like whatever I got to listen to.
Sure.
But I didn't know that was like a thing. I guess it just never dawned on me. I didn't really know. So I actually started with joining as many groups as I could. Like I started on Facebook, I joined the non-clinical PT group, I joined every alternative care provider, career path, you name it, I tried to join it. And literally, I was just like blown away at how many other people were in the same boat. I was like, I'm not crazy, I was crazy, but not that crazy anymore, right? Like it was like, it solidified that this is not just a me problem. And again, to circle back, like school didn't teach us that. It didn't teach us like, here's all your options that you can do with your degree. It was like, this is your job. Keep your blinders on and do it. Here's the specialties that you have, and that's your options. So a lot of guilt came with that, obviously, a lot of like fear of like, what's the unknown, which obviously is a huge component I talk about a lot with individuals now. But I joined all those groups, and eventually I just started plugging away and seeing postings for different jobs. And I came across a job on one of those platforms. And this was like, mind you, I was at it for months at this point. When I first started, it was just literally like I'm curious, like what options are there? And, a lot of people will know there's the biggest like pull for us at that point was like these reviewer jobs, right? I had gone to a bunch of mixers with other people that were trying to do the same thing. And so they would kind of talk about, and a lot of it was like reviewers, like billing, like accepting different billings and things, like navigators. I can't think of the proper terminology, but that never really appealed to me because one, at the time, like fully remote work wasn't something that was super attractive to me. I liked patient. This is pre-COVID. I liked patient-centered or like in being in people's faces, talking. So I wanted something that still was very interactive. And the biggest thing for me was that I wanted to still use my clinical brain. I wanted to somehow still be able to say, I know all of this knowledge. How can I still have an impact? So I just embedded myself in trying to like follow what other people were doing, join every community, every live event, workshop, until probably I would say like 8 months in, I saw a post for a job, and it was like a care specialist was what they called it.
Okay.
And everything. It was like patient interaction. You need to have good
Right. Oh,
treatment
this is
knowledge.
it,
You need
right?
to like da 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 da. And then it was like pay 85,000 base salary plus committed. And Samuel, I swear to you, I almost fell out. I was like,
I
what?
can do what? I can
I,
make
I was like,
chocolate cookies.
lie. I am betrayed. Someone is lying. This is a scam. I was like, okay, what's the catch? Because there's no way.
Sure. It was too good to be true.
There was no way, right?
Yeah.
Anyways, so I'm not kidding you. I went into a patient's home. I can visualize where I was. And I came out and I saw the posting. Every day after every patient, I was insufferable. Probably my poor husband at the time.
Wow.
I was like nonstop looking, checking
Yeah,
LinkedIn at the time, checking every platform. And I saw that post for that job, and I ran to my car, and I immediately like found who the recruiter was and messaged the recruiter. And I was like, I am perfect for this job. This job's for me. Like, I need this job. Like, how do I get this job? Like, basically, like, oh, so excited. Bless her heart, because she didn't think I was crazy enough to like ignore me. She responded and was like, send me your resume. And we ended up talking. The challenge then was like how to get me to be a good candidate, right? So it was ultimately a recruiter that I had come across with by doing all of this hours and weeks and months of just like connecting and finding someone. She took me in, really. She took me under her wing. She was like, I see something in you, but you don't have sales experience. You don't have this. You don't have this. And I was like, well, I have a really great resume. And she was like, your resume is terrible. Well,
You're like, wow, okay, I got it.
yeah. She's like, but you got a great personality. So we're going somewhere, So we spent months back and forth. She was helping so many other people. So there wasn't this dedicated time to me, right? That was like, so it was very frustrating. And so, fast forward that whole process, finally, it was a new company, not a new company, but it was a new division in a big company that was launching a product specifically into the rehab space. So I like to say, like, this is a dash of like luck, obviously, with like consistent persistence and just a lot of time.
Fast forward, you're doing the job now. I want to hear, and I want everybody to hear, what was the reality of this new job of medical sales? And I like this perspective because you had this whole life dedicated to physical therapy. You got to taste it, or you got to live it.
Oh, it was the best. Honestly, it was the best experience, best decision I've ever made in my life, hands down. I cannot stress enough how incredibly exciting it was to feel like, wait, I get to go now and not only help patients, but I get to help therapists and other providers and help all the patients in a facility. I literally had a conversation today with a nurse actually about this, the whole imposter syndrome. We all have it. We all have it. It is no way around it when we're so trained in one world that to then step into another world and expect to be like, I got this.
Yeah.
It doesn't matter how great you are, you have it at some aspect, So I had that too, but it was so comforting to go into a space that was so comfortable to me that I didn't even know was like real. Like, it dawned on me like, duh, like where did all these devices that we're using come from? Someone had to sell them to the facility.
Yeah.
Not like the administrators are walking around town looking for devices. Like, people are coming to. I was like, now it's so cool because I was on the other side of it, like I was the one getting to go in and not only meet with the therapist and the administrators, I was also standing there while they were working with the patients and helping them and giving them this like bigger picture of the long-term impacts of these devices and the impact it can have on overall patient care. And it was so rewarding. It doesn't really matter what the device is, like as far as, is this going to change, like save a life versus is it going to make better quality of life, right? Like that didn't matter to me as much as me enjoying the product and knowing that it was something that could benefit people. That was exciting to me. So it was a lot of training up front, I will admit, because none of us had any sales experience. So I think for us, it was that imposter syndrome really kicked in, right? Like, how am I going to sell something? And even though we were more clinical specialists at the time, there weren't any like territory managers because we were just launching the product. So we were really, we obviously grew into the territory managers, But so we kind of took on this big role, and lots of sales training was required, a lot of, money invested in that too, because that became part of the requirements for it. But it was really rewarding.
So let's talk about it, because I'm sure everyone is listening is like, okay, April's story is amazing, but April's not a medical sales rep today. Why? And what is April doing, and why does she prefer this than to what she just described was the best decision?
Yeah, great question. So when I worked for that company, I stayed with them for 3 years, which the irony of that is the longest job I ever kept. And the reason I did leave that job is honestly because the territory did get so massive. I grew that from 0 to 500 leads and a massive pipeline, very successful territory. And the honest reason that I left that job, and I'm sure there's people on here that will know the company and know me well, but there was no more growth within that organization. They had done some layoffs. Mind you, let me just backtrack this for a second. I got that job and then COVID hit. Okay. So let me tell you what, if you can sell a product during COVID, you could sell anything. But, we were literally faced with, I was faxing people stuff. Okay. Faxing people things. It was a struggle, but it really, it made me tough. Okay. But anyways, so then COVID kind of like partially left. I don't know. Anyways, we kind of moved through that. Sure. But then there was a lot of layoffs that came with that, right?
Figured out.
Yeah. So then they cut some of the roles where a lot of us that had been there for so many years were like, great, I can move into an AE role. I can move into, do a director role. There were so many layers to that that kind of excited us. Like there's so much opportunity. Well, they cut so much of that. Of course, those are all temporary cuts usually, but it's like, do you want to stick around and wait for it? Or do you potentially want to explore other options? So at the time, I literally was just like, I have come, I have seen, I have conquered. It is time for me to be more challenged. Literally, that was what I needed to do, was go and find something that was going to now take me to that next level. I'd grown the territory. I did all of that work. I had the skills now to go out. I knew how to sell myself. Their imposter syndrome did not exist anymore. I was like, put me in any setting, put me in coach. Like I got it. And also I wanted a smaller territory. So that's what's really cool about this that I tell people all the time is that they don't realize not every role is this massive 3-state territory. I was selling capital equipment.
Right.
You don't know that when you're getting in, when you're in your early stages, like what's the difference between capital equipment and what's a territory manager versus a clinical specialist role. And like, that's, stuff that we learn obviously, but so I wanted something smaller. I wanted to be a little bit more present. So the beauty of it was I knew exactly what to do at that point. I was like, so I found a surgical role and I loved it. I did neuromodulation. I went back to the clinical specialist side of things. It was great. It's funny because during that time, I had started to really feel passionate about wanting to help people do this because I was starting to get hit up on my LinkedIn, on Facebook. How did you do it? Like after COVID, it was like the cat's out the bag.
Wow.
And it was just a wave of burnt out clinicians being like, I am done. Get me out of here. What other options do I have? And that's when we started to see that influx of people wanting to explore medical sales. So I had connected with you at that point while I was doing that surgical role because I was going to find organizations like yourself. And I'd been connected with another company that was like, he's doing this. There's a bunch of clinicians starting to be interested. He's looking for more people to help, like with resumes and mentoring. And then I'll never forget, and this is the best story, I got laid off. That same day, I cried. I went and like got McDonald's and a McFlurry and ate French fries and was just like, my life is over. Okay, boohoo. And then I went home and I texted you. And I was like, Samuel, I know we've been trying to connect, but I have all the free time in the world now. What do you need? Do you remember that? And you were like, okay, let's chat. So I started working with you. I don't know if you remember this, but I started working with you as like sure, I'll help you out a few hours. My kids are in school. I have a severance it'll get me by till my husband gets home. I can help you. That was 2 years ago.
I know. It's wild. Wild. Come on. God works in mysterious ways.
I've had multiple offers.
Yeah, you get offers, yeah.
Multiple. All the time I'm getting hit up by people. And there's been times where I've actually waited and said, but what gravitates me to stay with Evolve Your Success, one, it's just in my nature as who I am, but I like to see projects through. That's why that first job, it was like,
Yeah.
I want to build
How
it.
will you make this work? Yeah.
Yeah. And I have loved seeing the growth, the impact. I always talked about that with impact. That's why in my core I wanted to be a physical
That was
therapist,
one of your
right?
drivers. Yeah.
Yeah. Like seeing those people be exactly how I was, and then knowing that they're just lost. Like
Beautiful.
they are just
Yeah.
lost, and being able to provide them some resources and a valuable path
Yeah.
that prevents what I had to go through.
Well,
I don't know. There's no device to me that does that for people.
that's beautiful. I love it. I love that, April. That's amazing. Thank you for sharing that with all of us. So let's talk a little bit about this PT 18-month stint that you were just hustling, grinding, trying to figure it out to get finally into medical sales. What's cool about even able to talk to you about this is you literally talk to people, hundreds of people every single day about what they need to get them to medical sales, especially people that come from a PT or a PT-like background. Why do they need it?
It's really tough for us. This is what I say with $50 success. Not to sound cheesy, but I'm like, really, like we have 100% success rate with healthcare workers. Like hands down, it's not a matter of if you're going to get a job.
Right.
It might be a matter of when,
Right.
but they are some of the most successful individuals. However, they're some of the most challenging up front because they just don't know what they don't know when it comes to this world. I mean, we say that for everybody, right? But what I mean is like, they're so knowledgeable. They're so intelligent. They worked so hard to get where they're going. So there is just so much fear and barriers and like objections that they continue to feed themselves because we have been taught like, this is what you're supposed to do, right? Like, and this is it. So it's really hard for us also to grasp like, I can do this and still make good money and have some freedom. Like it's not, I don't believe you. Like, I don't believe you. I'm not kidding you. It is like, I got the chills. I don't believe you, And so I love that. I love having that conversation with people and helping them. I always tell them all the time, I'm like, listen, you are not alone. We all feel this way. Imposter syndrome is real. Like we have a lot of guilt. You've invested so much money into your degree. That's a whole nother aspect, right? And so there's just a lot of reservation when it comes to it. I always tell them, I'm like, it's real humbling when you submit your resume. 16 revisions later, you're like a whole different person. Really, I had no idea. I thought that was a good resume.
Right.
Because you don't know how to sell yourself in this space. We've
Right.
never made it to.
Right.
As a therapist, it is, oh, you have a degree? You're a licensed physical. Can you start yesterday? We desperately need you yesterday.
Wait, you could walk? Oh, run in.
We live in a clinic, buddy. Also, I'm going to need you to work weekends. Office hours are no documentation time, by the way. And productivity is 99%. You're like, oh, this is my options, So, but we are not used to that. We are not used to being told no.
Yeah.
Other than from our patients. We are not used to 6 to 8 rounds of interviews. So it can be really difficult. It's very defeating. It's, applying, like you have this amazing, I've been an amazing clinician. I have made people walk again, like, what do you mean? We went with a different candidate. Like what candidate, And I tell people all the time, like medical sales is like the wild, wild west. If you want to specialize, you have to have that certification. Like it's very cookie cutter when it comes to
right. Yeah.
They come here and it's, you're competing against an attorney. You're competing against a veterinarian, you're competing against a radiology tech.
All people we've had in the program.
So you have to shapeshift a little bit. You have to be able to be coachable. You have to be willing to be like, what am I missing? What I say is like finding a program and organization that's what this is meant to do.
Mhm.
It not only teaches you all those foundational skills and provides that insight, but it teaches you what you're missing.
Yeah, it shows you what you're missing.
And then it trains you in that, right? And like that's what I think is so important and valuable for the healthcare workers, because they just don't know what they're really missing yet. And then when they do, they're like, oh, I don't know how to sell a device. And I'm like, what are you talking about?
Right.
You sell therapy all day long to like the worst patients.
That's, I think, man, April, I think you captured it with that one. That was perfect. That's exactly what happens in this program. That's why we have the success we have. And that's why we have the graduates and they go on to live these amazing medical sales professional lives. That was fantastic. April, this was great. Of course, if you're a fan of this show, you know this, but for those that are new, how can people find you, April?
Yeah, I mean, please, I'm on LinkedIn a lot now because I realize how important it is. No, but I love my LinkedIn. So please find me on LinkedIn. Don't be shy. This is what I do for my job now. So part of my job is getting to just interact with people. School, I don't know if people are,
Yeah, they can get access to, they go to evolvesuccess.com and you click on in the tab, in the menu that says Inside EYS, it takes you straight to school and you can join our free platform there and be connected to a whole world of medical sales professionals. April, it's been real. Again, folks, this is our very own April Hoffman, Enrollment Director for Evolve Success. Her story is amazing. So please, I hope you got some pros from it. We got one more thing to do, April, before I let you go. Are you ready? So this is the lightning round, April, and you can't prepare for it because like a bolt of lightning that you cannot prepare for, you just have to be ready to take it when it comes. So
don't judge me.
Now we will begin. First question, what's the best book you've read in the last 6 months?
Who reads books anymore? No, kidding. Oh God, this is embarrassing. You guys are embarrassing me. Okay, It Ends With Us. Oh my God, I can't believe I just said that out loud. Listen, I have my own hobbies. Okay,
that was a good one though. Oh my gosh. Okay, next question. What is the best TV show or movie you've seen in the last 6 months?
Oh, 1983.
What is that?
Wait, so Yellowstone? Have you seen Yellowstone?
Oh, 1883.
1883. I'm sorry.
Third question. We want the restaurant now and the location. Best meal you've had, the restaurant and the location.
Oh my gosh. I don't even remember. I was going to say the place that we went for dinner that one night.
That was more than 6 months ago, April.
Okay, you're right. Oh my God, that just goes to show how much I do not go out to eat. Oh, that's with a lot. My husband is Jamaican. He makes really great.
Okay, what's the best meal you've had then in the last 6 months?
The best meal would be probably some oxtail.
Oh God, that's my favorite. Okay, folks, to cover that one, the restaurant her and I did go to more than 6 months ago will be in the show notes. All right, and the last question, April, but not the least, what's the best experience you've had in the last 6 months?
Oh, best experience. Oh man, I will say probably having my husband home, honestly, and being able to, he's been gone for 3 years at a time, like no more than a few months at a time. This is the longest stretch over 6 months that we've had him home. And so doing all the things, having a flexible work schedule that's let us go to my kids' sports and all the things, like truly that's the best experience. I know that's probably not some resort or something.
That's beautiful. And thank you for sharing that. April, this was awesome. We got to have you back. We have so much more to talk about, but this was awesome. Thank you for being on.
Don't ask me about any more books because I'm not reading it.
Right.
Give me 6 months.
Awesome. And that was April Hoffman. I am just flat out impressed with that woman. She has experienced so much of what the professional working world has to offer in the healthcare space, even within medical sales. And now, for the last, 2 to 3 years, she's been talking to hundreds of people every single day about medical sales and what it can do for them. So her perspective, her insight is unlike any other. You'll talk to a rep that's in the field that only knows their experience. You'll talk to a coach that's only dealt with who they've dealt with. You'll talk to a company that's maybe been in one niche for a certain amount of time. But very rarely you're going to talk to someone that has that much of diversification on the different things they've done that can add valuable insight to what you're trying to do. As always, we do our best to bring you guests who are doing things different in the medical sales space. Make sure you subscribe to this podcast. If you are a listener, if you are someone that loves what you hear, then you got to subscribe so you're on top of every episode we produce. And then on top of that, if you're someone that wants to get into medical sales, you're in medical sales and you want to be better, make sure you visit ebarbersuccess.com. I hope you enjoyed today's episode. And remember, I have a customized and personalized program that gets you into the medical technology industry as a sales professional or any type of role for that matter. Become a top performer in your position and masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolvesuccess.com by visiting our site, filling out an application, schedule some time with one of our account executives, and allowing us to get you where you need to be. Stay tuned for more awesome content with amazing interviews on the Medical Sales Podcast.